everyone, and thank you so much for tuning in to Carly B TV. I'm Dr. Karlisha Booze. This week kicks off our Wellness Wednesday segment, and according to the CDC, diabetes is the seventh leading cause of death in the United States. Now, today I am joined by Cheryl Brett. She's a registered nutritionist at the Coliseum Health System here, and I want to talk to her more about this hot topic. So good morning, and thank you so much for joining us. How are you?
Good morning. I'm doing well. Thank you.
Great. So just to kick things off, Cheryl, can you please just tell us what is diabetes?
So basically, it's when your blood sugar levels are above normal for a long period of time. So blood sugar is also known as blood glucose, and it comes from the food that you eat. Now, normally, everybody has it in their bloodstream. And there's a hormone that your body makes, your pancreas makes it, called insulin. So under normal circumstances, insulin will take the sugar in your blood and shuttle it into your body cells because blood glucose is your body's main source of fuel for energy. So in diabetes, what happens is either your pancreas isn't making enough or it's making it, but your body cells have become resistant to it. So it can't get the sugar into your blood cells. So all it can do is circulate in your bloodstream and it's got nowhere to go. So abnormally high levels of blood sugar, it's not a good thing for your body. It's not a good thing for your blood cells. So a lot of comorbidities can result from that, such as, it can affect your eyesight, it can affect your nerve endings, it can affect your ability to heal. So it's pretty problematic.
So what causes diabetes, and what are some things that, people can do to avoid it?
So there's two types of diabetes you may have heard. So the first type is the type that you're basically born with, and you see this more often in young children. So these people need insulin administered to them daily in order to live. The second type, type 2 diabetes, is the more common kind. So this is the sort that you see developing in adulthood. And the causes, for the most part, it comes from being at a higher body weight than normal for your height. It also comes from physical inactivity, and it can also result from other lifestyle patterns, such as how you eat. Genetics can affect a lot of it as well, but you tend to see it develop more often in older adults.
So are there any symptoms? If so, what are they?
So some of the symptoms of diabetes, if you haven't been diagnosed and you're not sure whether you have it, is a lot of people with very high blood sugar tend to be thirsty all the time. You might be going to the bathroom an awful lot, urinating a lot more. You might feel fatigued. You might feel more tired. If you have wounds, then those wounds may not be healing very well. You might suddenly lose a lot of weight for apparently no reason, even though you're eating normally. So those are some of the major symptoms if you have diabetes and you're not sure if you have it.
Okay, now what does it mean when someone say they have pre-diabetes? What exactly does that mean?
So pre-diabetes is very similar to actual diabetes because your pancreas is making insulin, but your cells are starting to become resistant to it, but they're not fully. And your blood sugar levels are above normal, but they're not quite high enough to push you over into the diabetes, the full-blown diabetes. But having pre-diabetes, you're a lot more susceptible to eventually develop actual diabetes.
Now tell us about the class that's being offered for diabetes. People that, just want to know more about it. You guys offer that class. Talk to us about that.
Sure. Basically, it's a 4-hour class. Now it's a long class because basically we're describing the disease process of diabetes. And we're also teaching people the carbohydrate controlled diet, also known as the diabetic diet, which is the sort of diet that you have to follow when you've been diagnosed with diabetes in order to be able to manage your blood sugar levels better. So we teach people how to do that, and we teach people a lot of other things just to sort of help them learn how to, live with diabetes and get their sugars managed well.
Okay. Now, last question, how can someone register? Does it have to be a referral or, can they just simply sign up? How can they register for those classes?
Sure. If they're interested in attending the class, first of all, they would need to let their physician know, because we would need a referral from their primary care doctor. They would send that referral to our scheduling department. Then the scheduling department would contact that person and then figure out what's the most convenient day and time for them to attend the class.
Okay. Well, thank you so much, Cheryl, for talking with us about this. And for anyone who wants to attend the class, again, that class is offered once a month. That's every first Wednesday of the month.
Hey, are you experiencing algae, mold, dirt, or pollen around the foundation of your home and your driveway? If so, call Reed's when you're in need. Reed's Power Washing Service has next day service available. Select service less than 2 hours. You're thinking, Reed's Power Washing Service is homes, that's all we do. Nah, we do it all. Driveways, fences, porches, and we clean your rides. So call that number on your screen today and get you a free quote.